Good morning, everyone. Thank you very much for joining here on this Friday morning. It's 11 o'clock here, and I hope everyone is doing well. We're going to go ahead and get started here with this presentation. So as we go through, every few slides, we're going to have some opportunities to ask questions. So feel free to write your questions into chat. And as we kind of go through, sometimes you might have your question answered on the next slide or so. So what we'll do is we'll go through these slides, and then as we have those opportunities to ask questions, I'll go through and ask Nicole here those questions that we have that people ask, and we'll get those answered throughout the presentation. So if you got questions, feel free to ask away. And what's really nice here is that we do in Michigan here finally have this ability to sell 5-star plans. I mean, this is obviously a very rare thing to have occur. So, and it does provide us a great opportunity to be able to sell year round here. So one of the things that us over here at Insurance Advisors Direct wanted to make sure is that everyone's kind of fresh up on the rules of how 5-star plans work, whether it's through enrollment, marketing, and some of these other things as well too. So we're going to do a refresher course here. My name is Michael Worth here. I am the brokerage sales manager over at Insurance Advisors Direct. Also with us today, we have our friends from Blue Cross here, and we have Nicole Wingate. She is going to be going over this presentation for us and explaining how 5-star plans work and how Blue Cross's products will help fit that mix. So Nicole, I'll go ahead and give it over to you.
Okay, great. Thank you so much, Michael. It's like Michael said, my name is Nicole Wingate. I'm a account consultant for individual under 65 and Medicare in the Blue Cross Retail Sales and Marketing Unit. And so today we're going to go over the 5-star SEP enrollment, some marketing that we have available for agents and agencies, and also our advertisement that we have out as well. I know we've had a lot of billboards out there, wondering if you've seen them. They're everywhere. And also Michael asked me if I could throw a couple of slides in for our other products, just to review that really quickly. So we are gonna do all of that. So we are very pleased that we received the Medicare highest possible star ratings based on quality of care, service, and member satisfaction. This is very great for, this is a great opportunity for agents to assist your clients with a great option and also to grow your book of business with these 5-star products. So let's start off with the CMS enrollment rules for a MA 5-star plan. Michael, I just asked this one time, do you see did the slide change correctly?
Yes, it did. Yep, we are good to go.
Okay, great. All right. So possible enrollment effective dates are for the first of the month from January 1st to December 1st during the first year for which the plan has been assigned the overall performance rating of the 5 stars. The enrollment effective date is the first of the month following the month in which the plan receives the enrollment request. So of course, just like any enrollment, coverage will never begin in the middle of the month. Now, even though the enrollment period is over, a beneficiary can still use the 5-star SEP once from December 8th through November 30th of the following year. Once used, the 5-star SEP cannot be used again during the plan year. Okay, so it's just a one-time use SEP. The beneficiary can enroll in a MAPD plan, even if upcoming from just original Medicare or Medicare supplement with or without concurrent enrollment in a PDP. Individuals enrolled in Medicare plan with our 5-star plan may also switch to a different 5-star plan if they have that overall rating of a 5-star, but still can only switch one time as a SEP. Now, if an individual in either a MAPD plan or a PDP plan chooses to enroll in a MA only plan, for example, our BC and Elements plan, which is our only plan that does not include prescription drugs. And this is basically used by members that have credible drug coverage, like veterans insurance, for example. So those members, that individual would lose Part D coverage and must wait for upcoming enrollment period to obtain that Part D coverage under the normal enrollment rules. So a late enrollment penalty may apply also. All right, so how to enroll a member. An option to enroll a 5-star member has been added to our Destination RX enrollment tool, as shown below. If you look 5 boxes down, you'll see I'm enrolling in a 5-star Medicare plan. Now, if we understand that we just added this, but we do encourage the agents or everybody to enroll at electronic enrollment with our platform for all SEP enrollments. However, agents may use paper forms if necessary. What you want to do is go down, you go to, if you have a previous kit that's ordered around AEP that does not have that option, you can go to select SEP other and then write in 5-star SEP if you have an older enrollment. Now, for new enrollment kits, they do have that. If you want to look up any type of upload any enrollment kits or applications, they'll be found in Agent Community under Libraries. So what you want to do is go to Libraries, then Sales and Marketing Material folder, and then 2022 Stars Marketing. And you'll find all of the collateral for this SEP 5 stars plan. So Blue Cross has been working to put together various pieces of marketing collateral that general agencies and as well. Again, these can be found in Agent Community in our Libraries tab. Do we have any questions so far?
So far, I'm not seeing anything in the chat.
Okay, sounds good, sounds good. So how have we been advertising? Some examples here, we've been actually advertising the 5-star statewide. Some of the marketing efforts are newspaper marketing, Detroit Free Press with the special sections, full page newspaper advertisement in 43 newspapers statewide, campaign landing pages, social media, display ads, digital videos, direct mailers, billboards, TV commercials, radio commercials, like Sirius, Spotify, and Pandora. We've been on the radio and also email newsletters. So the next couple of slides, you'll also just get a little whiff of a little bit more of an example of how we've been using the advertising selection, like with our newspapers. These are running in newspapers in 80 of 83 Michigan counties. So in most counties, you'll see this in the newspaper. We also have front page Post-it notes, stickers on 43 newspapers in 81 counties to draw more attention to the full page ad. billboards. I just came back from Grand Rapids and I saw a couple of the 5-star plan billboards going down. There's one by my house down 275. You've probably seen a couple of these if you've been traveling around. So they're popping up everywhere. So let's take a look of our highlights of some of the 5-star plans and innovative benefits that we have. So we did a one-pager here, and we kind of put some of why Blue Cross Blue Shield. A lot of different benefits here. I'm just going to call out a couple here. For our medical, we have a 0 observation fee when held in ER for 72 hours. A lot of carriers don't have that. So we do not charge if they're being held on an observation fee instead of being admitted to the hospital or ER. We have a $0 diagnostic for labs, all of our plans, $100 towards bathroom safety bars to have that installed. So not the installation, but they'll give $100 towards the bars. No referrals for in-network specialists for our HMO, POS, and HMO plans. So that's huge. If the doctor's in the network, the specialist, there's no need for referrals. For traveling, we have no or low deductibles when traveling outside of the state for our HMO POS plans and our PPOs. Snowbird program, these are members that travel to Florida and Arizona. It's kind of a concierge department for them, help them get prescriptions and show them how their coverage works and help them with providers in those areas. We also have worldwide emergency transportation benefit. So we do have emergency and urgent care worldwide for all of our plans, but we did recently add worldwide emergency transportation benefit to that. We have our over-the-counter allowance where you can get quarterly allowance for drugs, health, and now even groceries. So they give you a kind of like a debit card where you can go and go to like Walgreens or CVS's and get groceries and other items. We have a catalog, so there's different ways that you can order those materials there. We also have options for optional supplemental buyups, where it's dental, vision, and hearing. With our HMO POS plans and HMO plans, all package 2s include dentures. All of our plans have no waiting periods or deductibles. And for looking up participating dentists, you want to go to mibluedentist.com. We also have the Part D senior savings model as well, which is included in all BCNA HMO POS and HMO plans, except for community value. And we're going to talk about that plan a little bit later in these slides. This Part D senior savings model actually caps insulin cost sharing at just $35 copay for a 30-day supply. So if a member is taking insulin, it caps it down, and so they don't have those high copays there. Of course, we have Silver Sneakers, which is locations nationwide. Even when you're traveling, they have a really great app that you can pull up your ID card and look at participating fitness centers as well. We have meals and transportation that's available. I believe this is in our Prime Value plan that we're going to be talking about as well. It does have to be approved by care management. Transportation is available to select counties. We have in-home support services, which is an online wellness check-in, shopping support, transportation, light housekeeping. This is a companionship for the seniors and more. We also have support for caregivers, which are digital-based coaching, education, support for caregivers. This is available in select plans as well. And then, of course, our Blue Cross mobile app. Love this app. You go right to the app. You can virtual member ID card. So if you lost your ID card or you need to order another one, you can do it right from the app. You can choose or change your primary care physician or review any claims the last time you or your co-pays. So the app is great. Let's talk about our plans or some of the highlights of our plans here.
There was a quick question that came up.
Okay.
It was, and I think this is actually probably going to be going into these plans you're about to cover right here, is how much is the OTC for food?
How much is the OTC for?
It says for food. I think one of the benefits. Yeah, for food.
So we're actually going to be covering the OTC benefits. Each plan has their allowance amount that they get to use. So for example, the Prime Value has a $75 OTC benefit that members can use. So they'll have $75 to buy any of their products each quarter. Now, the allowance doesn't carry over. So if they lose it, if they don't use it, they lose it. So they definitely want to use each allowance each quarter if they can, but it does not carry over. So each plan has their unique allowance that they get. And in the next couple of slides, we'll see that.
Wonderful, thank you.
Thanks, Michael. Got to remember to pause a little bit. Sometimes I can go a little fast. All right, so let's talk about some of the highlights of our HMO POS plan. We have a 0 in-network copay for primary care physicians, all plans, which is huge. 0 copay for virtual medical and behavioral health services, and that's in all plans. You can set that up. There's a 0 copay for that. I've used that a couple of times when I'm getting a little old here. I turn my neck and I somehow have a neck spasm. Go right to the app, pick a doctor to talk to, tell them about my troubles, and they were able to prescribe prescriptions at the nearest CVS for me. So it definitely works really great, especially if you have young kids, for those virtual medical appointments. We have our point of service, our POS benefit now counts towards the max out of pocket in all plans. 0 copay for tiers 1 and 2 for 90-day preferred retail mail pharmacy. 0 copay for tiers 1, copay for 31-day retail mail preferred pharmacy for all plans. And we're going to talk about this too. Our BC Advantage HMO POS plan with our Prime Value has a 0 pharmacy deductible as well. And we talked about the insulin for saving for members has that insulin product. This excludes our community value, but we'll talk about that as well. And then increased ER copay waiver to 3 days for all plans as well. Some innovative products, we talked about some of them, but I do want to highlight the ones that we didn't talk about, like our hearing aid allowance up to $1,200. That's at $600 per year every 3 years. Our vision allowance, we give you $100 to $150 across all plans except our Elements plan. Our Elements is the plan that has no prescription drug coverage. Over-the-counter allowance, with all of the plans, with most of the plans. We do have one region that I'm going to talk about that does not have this benefit, but you get $25 to $100 allowance per quarter. Meals, we talked about that, transportation, the in-home support, and the caregiver. So let's talk about our service area here. This is the BCN Advantage HMO POS service area, which is available for 70 counties, which is most of Michigan, as you see. And the members have to live in one of these counties at least 6 months out of the year to qualify for our HMO POS plan. We do have designated doctors and hospitals that they would choose. Choose a primary care physician who coordinates your care. Remember, there's no referrals necessary for in-network specialists. You get routine and follow-up care covered outside of Michigan, across or nationwide network with our Blue providers. And then, of course, urgency and emergency care with our, in the US, with our worldwide services here. There is a worldwide coverage as a combined $50,000 lifetime limit that applies to both urgent and emergency medical care as well. Wanted to point that out. Let's talk about one of our most popular plans and one of our newest plans, Prime Value. A lot of people love this plan. Why? Because some of the features include a 0 monthly premium. So that means members are not paying anything monthly for this plan. 0 medical deductible, except for our Region 3. I believe that has a $280 deductible, medical deductible, but all of the rest of the regions are 0 medical deductible. The POS service applies towards the max out of pocket, like we talked about. 0 copay for primary care physicians, $50 deductible, but not for tier 1 and tier 2s. Those are a $0 deductible, but only a $50 deductible for the rest. $100 vision allowance per 12 months, $600 per year for hearing aids, $75 a quarter for our over-the-counter allowance, no rollover. And in-home support, we have that, and also the transportation. One of our other plans that I wanted to highlight is the Community Value Plan. This is a new plan. This is available in 7 Michigan counties, as you see here: Genesee, Livingston, Macomb, Oakland, St. Clair, Washtenaw, and Wayne counties. Now, this plan has 180 in-network primary care physicians that a member will choose. It's a $20 monthly premium. It's a 0 in-network medical deductible, but it does have a 250 point of service deductible. So members that travel outside and use the POS point of service to see follow-up care for the doctor, they do have a 250 point of service deductible. 0 pharmacy deductible, $100 for over-the-counter allowance. Remember, they can use that $100. They'll get that each quarter. So that's $400 a year, but they cannot roll it over. So if they don't use it that quarter, they lose it. But very great benefit there, $100. Full access to the entire BCN Advantage HMO POS network for specialists. So even though they have to choose their primary doctor within that 880 network primary care provider network, they can use any specialist in that 70 county area as the rest of the HMO POS network for specialists and facilities. Urgent care and emergency covered worldwide. And they also have a dedicated prescription drug formulary as well. So they have a separate formulary for this plan. They have comprehensive dental, vision, and hearing benefits built in right into the plan. So this is the only plan that does not have the option for the supplemental buy-up, where you can add on dental, because they already included it into this plan. So that's what makes this plan a little bit unique, because they added some of those benefits within the plan. So for the dental, it's a zero preventative dental services. They get $2,000 comprehensive dental allowance. Vision, $150 allowance every 12 months for eyeglasses and contacts. And hearing, they give you $750 for hearing aids per ear every 3 years. So this plan is a little bit more unique than our other plans, but you can see why a lot of people may like it. It has that already built in, some of those built-in benefits there. So this is our overall plan structure for HMO POS. We have 5 plans, five-star plans for HMO POS. We have 1 HMO plan without the POS that I'm going to talk about after these slides. So just to highlight some of this here, we talked about our prime value, which is one of our most popular plans. It has a $0 monthly premium. It includes prescription drugs, 0 for primary care physician. Now, over the counter, our region 3 is the only region that does not have this benefit. You ask me why, I'm not sure exactly why region 3 is a little bit different than all of the other regions. But we do have our region 4, it's a $25 allowance, but $75 for regions 1, 2, and 5. Medical deductible is 0, except for our region 3 has a $280 deductible. And then the max out of pocket, $4,500. Elements, again, is our only plan that has no prescription drugs with Blue Cross Blue Shield and Blue Care Network. The only one, usually somebody who would go into this plan has credible coverage already, railroad or VA insurance that they can use with this plan. Classic is more of a balanced plan between cost and coverage. And then our Prestige is a little bit extended plan where you're paying a little bit higher premium, maybe a little bit lower co-pays there. And then our Community Value plan, which has a unique PCP network of 880 doctors, but you can still use our specialists within that 70 county service area, like our other HMOs. But this plan has that extra benefits built into the plan, like the dental, the vision. So you don't have to use a buy-up, one of our buy-up plans with that. Speaking of the buy-up, so for all of our HMO plans, except for Community Value, if a member needs extra dental or vision, now we do have preventative dental and vision that's included in all of the plans, but if they're looking for a little bit of extra dental or vision, they can opt for our optional supplemental dental and vision plans. We have 2 options. Option 1 is more of a basic option. It's $20.40 a month. Or option 2, which is $32.40 a month. Both of them have no deductibles, both of them no waiting periods. As you see, our option 1 has 1,500 combined in and out of network annual maximum with the 0 coinsurance for in-network, 50% coinsurance for out-of-network here. And our option 2 is a little the same, but the benefits a little bit higher, 2,500 combined in network annual max. They have the 0 co-insurance for in-network, 50% co-insurance for out-of-network. The difference between the 2, other than the amounts, is we carry the dentures in our option 2 for all of our option 2. You'll find that there. So again, if the member needs some extra dental this year, but next year they don't, they can always drop the plan for next year. This just talks about the vision here as well. And as you see, the different amounts here, 200 combined in network, 300 here. Same as out of network, 50% coinsurance, up to 200 combined. Over here, 50 and 300 combined. So great plans. All right, let's talk about our one HMO plan. Now, the difference between our HMO POS and our HMO plan is our HMO POS plans, you can still use that POS to travel, to see a doctor. With our HMO plans, does not have that POS benefit. So you still have emergency and urgent care worldwide, but you will not be covered for any follow-up outside of that. Our one HMO plan is Connected Care. This is available if you reside in one of these 11 Michigan counties, here, shown here. This is more of a focused provider network with our Trinity and Ascension hospitals like St. Joe's and St. Mary's hospitals. They have more than 19,000 in-network providers, 24 acute hospitals. It features a zero primary care physician copay, zero medical deductible, no referrals required for in-network specialists. It does have a $25 allowance per quarter for the over-the-counter items. Routine vision, preventative dental benefits. It also has that worldwide emergency and urgent care as well. These are the hospitals for the Connected Care. As you see, they have Ascension hospitals like the Providence, some Henry Fords. As you see, it does not have that Henry Ford downtown on the boulevard, but they do have the Macomb and Wyandotte Hospital there, St. Joe's and St. Mary's. So if a member goes to one of these hospitals, it may be a good thing to look into the Connected Care if it fits. This is the service area, the 11 counties. Choose a primary care physician who will coordinate your benefits for you. And remember, it does have emergency and urgent care worldwide. This is just a snapshot of some of the benefits. It's a $58 a month, so it's more of a balanced plan. Zero medical deductible, does include prescription drugs. And as you see here, they're pretty low, the cost share for here for this plan. It does have dental, vision, hearing that you can opt for. There's two options, option one, $1,350, option two, $3,550, very similar to our HMO POS, zero deductible, no waiting period. You need it this year, but you don't need it next year. You can always drop it. Our option two includes the dentures. Okay, so that is our presentation for the 5-star. I do, however, have a few slides that I added to talk about some of our other plans real quickly. Were there any questions in the chat, Michael?
No, there's no updated questions.
Okay.
Looks like I'm getting some feedback on my sound here. But yeah, right now, if anyone has any questions, feel free to ask away right now. As she gets her next slide, set of slides here set up. Is there any other questions from anyone out there right now on anything you've heard so far? Let's see here. Well, I'm not seeing anything pop up. If anything does pop up, I'll oh wait, oh, there's a question here. Will any of these plans offer implants?
Not so far, they don't. I'm not sure in the future if they will, but as of now, they are not covered.
All right.
Yeah, Thanks for that question.
Yeah.
All right, let's
All right,
talk about our PPO plan, Preferred Provider Organization. Some highlights from our PPO plan: you can choose any doctor or healthcare facility, no referrals necessary. Monthly premiums are as low as $0. We do have a $0 PPO plan that we're going to talk about. Zero medical deductible for all plans, which is huge. Zero prescription drug deductible for all plans, also huge. Zero copay for tiers 1 and 2 for a 90-day preferred retail or mail pharmacy. Zero tier 1 copay for 31 days preferred retail mail pharmacies for all plans. Zero copay for PCP office visits. And I believe that's all plans as well. Zero copay for COVID-19 testing and vaccinations. Zero copay for virtual PCP and behavioral services. These plans have emergency and urgent care worldwide, along with the transportation. It does have vision and hearing built into the plan, along with the preventative services as well. This is the service area. So if you live in any of these colored states here, and all of them are filled in with our PPO, you live here 6 months out of the year, you qualify for our PPO plan. So these are our plans, snapshot at a glance here. We have 4 PPO plans: Essential, Vitality, Signature, and Assure. I would say that our Essential is one of our most popular plans. There's only one region that has a $10 premium for it, but all the rest of them are a $0 premium, which is huge. Part D is covered all of our plans. Primary care physicians, as I talked about, zero copay. All of the over-the-counter allowances, except for Essential, this is a $50 over-the-counter allowance. The rest are $25 a quarter. You have to use it or you lose it. Medical deductibles are $0. And as you see, the out-of-pocket maximums are pretty low. All of our PPO plans also have an option for supplemental benefits for like a buy-up for dental and vision. They all have the same price point this year. So no matter what plan you pick, it's $22.40. Each month they'll get you the extra dental, $2,500 annual maximum combined. We have a 25% coinsurance for in-network, but if you go out of the network, it's a 50% coinsurance out of network. Vision coverage, the same, $250 vision allowance combined in network, 50% coinsurance out of network. Let's talk about our Medicare supplement plan. So some highlights of this plan with our Medicare supplement plan coverage, also called a Medigap. It's a cost savings health policy that works together with original Medicare, Part A, hospital, and Part B, medical, to help cover certain costs that original Medicare doesn't. It offers great benefits, as you see. We added new dental, just like the buy-ups for our MAPD plans. We have the dental for our med sub plans, which really went over well. Great price point, only $15.25 per month. So members can go into this, same thing, no waiting period. I believe there's no deductibles for this plan. They need it this year, but don't need it next year. They can always opt out. Unfortunately, they do not have dentures that are covered yet with our dental, vision, hearing packages for our med sub plans, but hopefully maybe this upcoming year. We have also enhancements. We have virtual well-being programs for our med sub members like WellV, which is a surgical decision support program. It has a lot of webinars. You could ask questions to doctors about, you know, these surgeries that you may have to indulge in. 24-hour nurse line as well. And then members that live in the same household that has a Blue Cross Blue Shield supplement plan will get a premium discount of 5% if they live in the same household. So we do have a My BCN, the HMO med sub plan that's kind of closed right now. If those members have that plan, they're not eligible for this 5% discount, but any Blue Cross Blue Shield med sub plans, and they live in the same household, they can get this 5% discount. Now, this is not automatic. So if a member, let's say a wife has this discount or it has med sub plan already, and then the husband is aging into Medicare, he would just call in, or there's a option on the application that you can add in that 5% if a member is already, if there's two members that have a med sub plan in that same household. With our med sub plans, no network restrictions. You can keep your own doctor as long as he accepts original Medicare. Use any specialist who accepts original Medicare, no referrals required. And this is nationwide coverage, great for snowboarders who live and travel outside of Michigan. And really quickly, wanted to talk about our PDP plans. We have two options this year. We have our basic plan, which is $96.20. Then we have our Blue Premium, which is $113.70. Here's a little overview of it. We do have a deductible for the basic plan, $480 deductible, no deductible with our enhanced Blue Premium plan there, 5-tier formulary, and we do have preferred pharmacies that you can go to as well. So that was what we had there.
Wonderful. I'm not seeing any questions here in chat right now at the moment. However, this is a great opportunity to make sure you ask any questions that you may have. And this could be related to any of the products. It could be related to the 5-star. You know, this is the opportunity here to ask any questions. So if anyone has any other questions, feel free to ask away. I want to thank, of course, everyone, and thank you, Nicole, for helping us out here with this, presentation, explaining what Blue Cross has to offer, as well as how those 5-star plans work. Here at IED, if you're not already contracted with Blue Cross, if you give me a call, I'll be sending out an email to everybody. Oh, there's a question here. Can this presentation with the recording be emailed to me? I'm not sure if we're able to email them. However, it will be up on our YouTube page. So if you do want to go on YouTube and search IAD brokerage, you'll be able to find us on there. If you subscribe to that, you'll be able to find it there. What I could probably do is once that's put up there, I can email you a link to that video. So Nicole, once again, thank you. I'm not seeing any other questions in chat. Do you have anything else you wanted to add here?
No, I just want to say thank you, everybody, for participating. This is a real great opportunity to help members with another great option from our 5-star plans, and also grow your book of business. So we really want everybody to see a seed here. So again, thank you guys. Happy Friday. We had some great weather yesterday. Enjoy. Hopefully we see that trend going further. And I thank you for joining.
Wonderful. Thank you so much, everyone. Have
Thanks,
a fantastic day.
Okay. Bye-bye.
Bye now.